The medical uses of ionizing radiation, and here we mean X rays and gamma rays, can be split into two classes: treatment or being able to see inside the body. We could also call those therapeutic or diagnostic. If we use them for diagnosis, that's called medical imaging. There are, of course, other kinds of imaging that don't use ionizing radiation, so you can have as much of it as you want, basically, like MRIs and ultrasound. If we're going to use ionizing radiation, though, since they all do different things, there are two main methods to do that. One is transmission and one is emission. Regular X rays, or the more advanced CT scans, are transmission based, and they work by beaming a certain amount of X ray energy through the body and collecting what gets through to the other side. Bones that have calcium and other high Z, and remember that means high proton count, uh, minerals, when they're in the way, they'll block a lot of the radiation because they have lots of electrons to interfere with it. And that's compared to places where you have soft tissue, which is usually lower atomic number and easier to get an X ray through. On film based X rays, that means the bones are sort of protecting the film from being exposed, and then when developed, they show up dark. Here's one of the world's first X ray pictures, made by Roentgen more than 100 years ago. You can see the bones in the hand very clearly, and you can also see a ring on the hand. Those are all doing a good job blocking X rays. CT scans are essentially taking lots of X rays from different angles and then reconstructing them to make a 3D object. So, for example, let's say we have a box we can't see inside. We take a single X ray, we might get this picture, this gray triangle. We shoot from a different angle, we might get this circle. If we have a CT scan, though, we're looking at it from many, many different angles. We can reconstruct it and we get something like this. We see that it's really a cone, and now we can rotate it because now we've made it a 3D object. And that's one of the real values of the CT scan. You can look at all sorts of different viewpoints. This wouldn't do much on its own because a photon from anywhere in the body could hit anywhere on the film. So even if you could pinpoint the location of where the X-ray hit the detector, that doesn't tell you anything about the path that the photon took through the body. So it's kind of like if you held up an unexposed piece of film to your window, you're not going to get a picture of the outside world. You need some kind of lens. And as we've said before, we can't focus gamma rays. We can't even focus X-rays. The best we can do is something called collimation. And what that means is aiming them one way and then only catching the X-rays that are aimed that way. Here in this picture, we've got the green line representing a path from the X-ray source down here to the detector, and these slanted lines here would be made out of lead, so that the only X-rays that are going to get through are going to be the ones aimed this way. Over here, this red line represents an X-ray that went in, got scattered, came out at a different direction, and now it's not going to be able to go through because it's not at the right angle anymore. This works kind of the way looking through a cardboard tube does. It doesn't focus light, but it reduces the area that the light you see can come from. The reason to do this is this scatter, what it does is reduce the contrast of things, and that means it makes dark things look less dark and light things look less light. It kind of overall makes it a lower quality image. So the best we can do is get rid of the scatter, most of it, by restricting the X-rays to ones that went straight through the body without scattering. And that's what these sort of aiming tubes are. And this is in the shape of a honeycomb, and it works kind of like blinders on a horse. It restricts us to only X-rays that came from the source, went through the body, and didn't scatter, largely. The reason you can't see stars during the day is scatter. It's the scattering of sunlight by air molecules. It makes the sky nice and blue, but you can't see the stars anymore because the contrast is so reduced. And what we do with the CT scan is make what's called an attenuation map. So in other words, we're looking at where are the parts of the body that are really good at blocking X-rays. That's what we're making a map of with the CT scan, and we'll use it for other kinds of imaging later.